In this video, we're going to talk about chemoreceptors and how they change the characteristics or the rhythm of breathing in the depth. So the chemoreceptors that we're looking at in the blood, so looking at the blood or the CSF, are going to be pH, and oftentimes it's looking at low pH, but we can look at high pH as well. The partial pressure of oxygen, so looking at the amount of oxygen that's in your blood. And the major one is actually the partial pressure of carbon dioxide. So based on what this is happening with the pH, and oftentimes the pH and carbon dioxide go hand in hand, because remember, carbon dioxide, the way it's transported is through carbonic acid and has extra proton donations in the red blood cells. So this actually increase of carbon dioxide is actually lowering the pH or making the blood more acidic. So those go hand in hand. Under normal conditions, so say all of a sudden you hold your breath and the partial pressure of your carbon dioxide is increasing because you're not breathing in oxygen, or you're not breathing out carbon dioxide is the major one. You're not giving it off through your alveoli and out your body. Then it's building up. So actually, the buildup of carbon dioxide is the most important factor that influences respiration. So if you're holding your breath and your carbon dioxide levels are increasing, that's what's actually going to stimulate you to breathe and stop holding your breath, is your carbon dioxide levels, not actually your oxygen levels. They're important, but the brain focus more on this and making it breathe versus what the traditionally you would think is partial pressure of oxygen. So it's actually carbon dioxide that's the most important factor in making you breathe, and kind of how fast and how slow you're breathing is because of carbon dioxide, not because of oxygen. We're going to talk about this next. So again, chemoreceptors are really focusing on the partial pressure of carbon dioxide. That's what we're going to focus on. But like I said, carbon dioxide levels and pH levels go hand in hand. Carbon dioxide has an influence on pH. So it's the same thing. If there's high carbon dioxide, like you can see here, then you're going to have a lower pH, because again, carbonic acid and protons increase, so you're going to be more acidic. And opposite, if you have low carbon dioxide, then you have less carbonic acid in your body than normal, and that's actually going to increase your pH. So now we're going to look at kind of why we would change our respiratory rate based on these things. So look at what I just kind of showed. If you have an increase in carbon dioxide, which would cause a decrease in pH because you become more acidic, and increase carbon dioxide, decrease pH because of that carbonic acid and the protons, both are going to cause increased respiratory rate. Now think about why that would be. Well, if you're increasing your respiratory rate, then you're going to increase movement of carbon dioxide out of your lungs. So you're going to continue that kind of transport of carbon dioxide, and then transition from carbonic acid to carbon dioxide and water, and you're going to get rid of it. So both increasing respiratory rate is going to get rid of carbon dioxide because you're going to transform it from carbonic acid, but also it's going to increase your pH again, get it back towards normal, because of the same thing. You're going to take carbonic acid and you're going to break it into CO2 and water. So this way you're getting less acid out of your blood, and you're getting rid of the carbon dioxide by breathing it off. Then it goes into alveoli and pulmonary ventilation takes over, and you blow it out into the atmosphere. So that's where you would want to increase your respiratory rate. Opposite, If for whatever reason you have low carbon dioxide, a lot of times that's you've been hyperventilating, and you have breathing off too much carbon dioxide, then you're going to increase your pH. Same thing. You have less carbon dioxide, you have less in transport, so you have less carbonic acid and protons, then you're going to have a higher pH. So both of those, we're going to want to keep carbon dioxide. You do have a level of carbon dioxide that you are looking at, and you do have that partial pressure that's kind of maintained around 40 a lot. It doesn't vary as much as what we saw in oxygen when we looked at that video where the partial pressure of oxygen could go from um, 40 to 100 in the body, but a lot of times the partial pressure of carbon dioxide went from 46 to 40. So it's not as variable. We do keep some around and helps maintain our pH. So what you're going to do is decrease your respiratory rate. That way, it's not going into your alveoli, it's not being expelled by pulmonary ventilation, and more of it will stay as carbonic acid and maintain those protons in the red blood cells. So you'll decrease the pH. So by decreasing your respiratory rate, breathing slower, then that's going to oppose those two things together. So now we're going to look at capnia. So when we talk about hyper, which is high, when we talk about capnia, that is looking at carbon dioxide. So hypercapnia is high carbon dioxide. And most often, we just looked at it, having too much carbon dioxide, for whatever reason, it's caused by hypoventilation. So we talked about pulmonary ventilation, breathing. So breathing. And hypo means low. So this is a low rate of breathing. So the same thing, we tend to get hypercapnia or high carbon dioxide because we're not breathing fast enough. And oftentimes why we also focus on carbon dioxide with our pH hand in hand, well, if we're having too much carbon dioxide and we're not breathing very often, well, then we can kind of tell that we're not getting enough oxygen on top of it. So you have the increase in partial pressure of carbon dioxide by those chemoreceptors throughout your body and brain, so brain and bloodstream. So if you have too much of carbon dioxide, you're going to increase your respiratory rate. So you are going to start breathing faster. So you breathe faster. Again, more CO2 into the alveoli, and then you breathe it out through ventilation. So, and you get rid of it. So that's how you oppose it. Too much carbon dioxide, your chemoreceptors are going to be like, okay, breathe faster. So then we look at the effect of that on pH. So again, always remember increased carbon dioxide means decreased pH. And a low pH is acids. So anything less than 7. So if you have what we just talked about of hypercapnia, so high and capnia is CO2. Because you haven't been breathing as fast, so you have low breathing, then you get what we call respiratory acidosis, meaning your blood PCO2, so your blood partial pressure of carbon dioxide is high, just showed you, and that causes the decrease in pH. So the acidosis is because of the decreased pH. Why do we say respiratory? It's because you're not breathing fast enough. You have a slow rate of breathing. So can become because of multiple different reasons. If you have central nervous system depression for many reasons, neuromuscular diseases where your diaphragm and your intercostal muscles aren't working or innervated as much. Something chest trauma or some sort of lung disease that happens acutely. So then you're going to have this respiratory acidosis. So again, because you have more CO2, you're going to transport it. Remember, 70% is transported by bicarbonate, but you also have that. So you have H3CO minus, and you have carbonic acid. So if you have more CO2, a lot of times you'll have bicarbonate ions, but more of it is going to be also in carbonic acid. Less is going to dissociate into bicarbonate. So if you have more carbon dioxide, you're going to have more carbonic acid. So what you do, your chemoreceptors are going to sense this. They're going to sense the high carbon dioxide level, the high or the low pH, the acidity, and you're going to breathe off more carbon dioxide. And this is going to come from other kind of regions that you're going to increase your bicarbonate levels. So you're actually going to get to help with buffering. So that's going to help less acid in your blood, more kind of a base or a buffer so that you can decrease or increase your pH again. So acidosis, low pH because of high carbon dioxide. Low rate of breathing caused it. You're going to increase your rate of breathing to oppose it. So this is just looking at it again. Hypercapnia. So looking at the levels of carbon dioxide, so high CO2 levels. Then you have stimulated by your chemoreceptors, you have the high CO2 levels and decreased pH, which is an acid. So you have acidosis. That causes stimulation. So in the arteries in the medulla oblongata, well, where do we increase our rate of breathing is in the brainstem. So you stimulate your respiratory muscles. So you stimulate the diaphragm and the external intercostals more often. So you have increased respiratory rate. So you get rid of more CO2 at the alveoli. You have less carbonic acid. So then you have the decrease back down to its normal level. Now we're looking at the opposite. So when we say a high pH, oftentimes we use the term alkaline when instead of basic, it's alkaline. So respiratory alkalosis is because of a higher pH due to your respiratory rate. So this is looking at hypocapnia. So again, capnia, CO2, hypo, low. So a high pH is because of a low CO2, less carbonic acid, then you're not having as much carbon dioxide in your body and your pH goes up and becomes alkaline. This, just like kind of acidosis is because of breathing too slow, this is breathing too much. So hyper meaning up, ventilation meaning breathing, you're breathing too fast. Too much breathing, you're getting rid of too much carbon dioxide. So you get rid of too much carbon dioxide, it increases your pH in your body. So this causes sometimes anxiety. So if you have a panic attack, hyperventilation can occur. Sometimes fever can increase your breathing rate or injury. High altitude can increase your breathing rate because it's lower oxygen levels as well. So you're trying to get more oxygen and you're breathing off too much carbon dioxide. So this is also why another reason why carbon dioxide, we use it. So if you're having an anxiety attack, a lot of times people say breathe into a paper bag. Well, you're breathing so fast and you have a low carbon dioxide level. If you're breathing into the paper bag, then you're breathing in more percentage of carbon dioxide. So you're actually getting your carbon dioxide back to its normal level and increasing it by breathing into that paper bag, which then will slow down your rate of breathing. So again, you have a decrease in carbon dioxide with respiratory alkalosis, which means increased blood pH because you've lost carbonic acid, and you are again decreasing your bicarbonate because it is a buffer that you use. The major part that we need to know is alkalosis is low carbon dioxide, high pH because of hyperventilation. So again, we're looking at it, hypocapnia, low CO2 levels. Chemoreceptors in the same spots in the arteries in the medulla oblongata are going to be inhibited because there's low partial pressure of carbon dioxide and a high pH. So you're actually going to inhibit your respiratory muscles. So less impulses means less contraction of your diaphragm and your intercostal muscles, so that you're breathing less often. So you decrease your respiratory rate, less breathing off of carbon dioxide to increase your levels back to normal.